Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. I hope this will be very convenient for your continuous study. As usual, today also we shall continue with one short clinical case discussion. The case for today is infant of diabetic mother with a weight of 4.4 kg weight is presented with the seizures after 16 hours of the birth. What is the cause? Okay, before going to the options, let us discuss about the question. Infant of diabetic mother. So mother is diabetic with a weight of 4.4 kg. We always say that diabetic mother used to give delivery or used to give birth to a macrosomic child. That means large for gestational age or a birth weight of more than 3.5 kg. So it is quite common in diabetic mother. So here weight of the baby is 4.4 kg. Rightly the diabetic mother is there. And the problem is she presented with the seizures after 16 hours after the birth. And what is the cause? What is the cause for these seizures? First 16 hours there is no problem at all, and after 16 hours there is seizures. And what is the cause? The options are hypoglycemia, hypocalcemia, birth asphyxia, and intraventricular hemorrhage. Now one thing we have to understand regarding diabetic mother is, so when mother is diabetic and fetus is present inside the uterus, and we know that fetus receives the blood circulation from the placenta, and the blood circulation to this placenta is from the maternal side. Now suppose if the mother is diabetic, so it is quite natural that her blood is hyperglycemic blood. It contains more amount of the glucose. And that high glucose containing blood which is present in the maternal blood, so it is also circulating into the placenta, and placenta is also receiving hyperglycemic blood, and same blood is also going to the baby, that is fetus. So fetus is also rightly receiving the hyperglycemic blood. Now fetus has to metabolize this extra amount of the glucose which is coming through the blood of the diabetic mother. The fact is, although hyperglycemic blood is passing through the placenta and entering into the fetus, the insulin which is required for the metabolism of this particular glucose from the mother is not reaching the baby. Okay, insulin from the mother is not reaching the baby. Placental barrier will going to prevent it. So only the hyperglycemic blood is reaching to the baby. Now what happens? Fetus has to metabolize this particular hyperglycemic, that is extra amount of the glucose, by its own. So therefore fetal pancreas which is present there, so that will now start producing the insulin. Previously also it is producing the insulin when the baby is, suppose in a normal baby is receiving the normal amount of the glucose from the maternal side, that is also metabolized from the fetal pancreatic insulin itself. But in this scenario where fetus is receiving a hyperglycemic blood, extra amount of the glucose, now fetal pancreas has to work more, and as a result more and more insulin will be produced from the fetal pancreatic beta cells itself. So when this being the case, fetal pancreas with the beta cells, they undergo hypertrophy to produce more amount of the insulin to metabolize the extra amount of the glucose. So this process continues for 9 months, and in the process what happens is the fetal pancreas undergo hypertrophy, and after the metabolism of this glucose, the fetal weight also going to increase, and that is the reason why fetus become large for gestational age, or you can say macrosomic. That is the reason. Okay, so immediately after the birth, what is the problem is, as the maternal blood supply is cut off, but fetal pancreas has already undergone hyperplasia, and producing extra amount of the insulin, and whatever the glucose which is present, so that will be very fastly metabolized, and there will be scarcity of the glucose, because insulin level is very high because it's already undergone hyperplasia. But after birth there is no hyperglycemic blood coming from the mother. Baby has to take the feed and get the glucose, but insulin production is high because it is undergone hyperplasia. That's the reason immediately after the birth, in a diabetic mother, the baby will have immediate complication for the baby is hypoglycemia. Hypoglycemia, because insulin production is more, and that will metabolize the glucose very fastly, and in the blood there will be hypoglycemia, and that leads to the formation or manifestations like seizures, etc. This may be the case in this particular case. What are the options? Hypoglycemia, hypocalcemia, birth asphyxia, and intraventricular hemorrhage. So out of these four, it looks that hypoglycemia is the most common, probably the most preferable choice, that is hypoglycemia. Let us discuss further. But you should know this is a fact which is taking place. Now you can ask, what happens to that hyperplasia of the pancreatic beta cells in future? As the day passes, what happens? The amount of the glucose in the fetal blood is consistently low compared to amount of the blood in the blood of the neonate after birth is consistently low or up to the normal level compared to the fetal level. In the fetal level, it is a hyperglycemic, but after birth, baby has to take its own feed, so glucose level will be under normal limits. So by looking at this, what happens? Gradually the hyperplasia which has taken place in the pancreas gradually regresses, and by 1 or 2 months, so that will come to the normal level. But immediately there will be problem. Immediately this regression of, that means regression of this hyperplasia of the pancreas will not take place in 1 or 2 days, isn't it? It takes some time. But in that particular 1 or 2 weeks or 2 days, so there will be a lot of problem related to hypoglycemia. Let us discuss further. In the case of the diabetic mother, excess glucose in the blood reaches the fetus and metabolizes, so fetus produce more insulin from the pancreas as the maternal insulin cannot pass the placenta. Same thing what I told. So fetal beta cells will undergo hyperplasia, and at the time of the birth there will be hypoglycemia, as I explained, which may lead to seizures. Yes, our analysis is right. So more insulin in the baby and insulin-like growth factors will metabolize the excess glucose in the fetal life, and baby become macrosomic. So no more insulin will decrease. Now the more insulin will decrease the level of the surfactant level also. This is the extra point. See, more insulin will also decrease the level of the surfactant, so baby is more prone to hyaline membrane disease. So birth asphyxia may occur. One more option here is birth asphyxia. Okay, so infant with a diabetic mother, when the baby delivered, baby may also have birth asphyxia. The reason is more insulin in the fetal body, because fetus is producing more insulin to metabolize the glucose. So that insulin is also adversely affects the production of the surfactant. It decreases the production of the surfactant, so that may lead to hyaline membrane disease in the baby. So baby of the diabetic mother, along with the hypoglycemia, may also have birth asphyxia. The reason is very simple. Surfactant production will be hampered by the extra amount of the insulin, so that may lead to hyaline membrane disease, and therefore birth asphyxia may occur. Otherwise, this hyaline membrane disease is quite common in preterm or low birth weight babies, but in diabetic mother baby this can occur. See, these are some of the other important complications that can occur to a baby with a diabetic mother. Number one is hypoglycemia, the most common and immediate complication we have already discussed. There may be hypocalcemia, there may be polycythemia, there may be hyperbilirubinemia, there may be hyaline membrane disease, as I discussed, neural tube defects. These are some late complications. Neural tube defects, sacral agenesis, that is most specific. Some of the cardiac defects like VSD, ASD and TGA, and renal vein thrombosis, lazy left colon syndrome, hairy pinna and macrosomia. See, these are all the complications of mother being diabetic, and these are the expected complication in the baby of the diabetic mother. But among them, the immediate and sudden complication, that is always hypoglycemia, which occurs immediately after birth. So these are the things which occur later. Okay, so that will be, you will come to know that these problems will be there in the later part, and they are not causing much problem immediately. Okay, so suppose the question is like immediate complication, that is always hypoglycemia. So this is all for today. The next class again we will start with one more important clinical discussion. Thank you.